Number 12, Teanau Tuiono.
Mr. Speaker, my question is to the Minister for Workplace Relations and Safety and asks, what are the current costs of workplace deaths and injuries in Aotearoa, and what is the modelled impact, if any, of her health and safety reforms on this cost?
The Honourable Brooke van Velden.
Mr. Speaker, officials inform me that it is difficult to reliably estimate the costs of workplace deaths, injuries and illness in New Zealand. By that they mean it's hard to establish causation. Basically, you can't predict the future of such a wide range of individual human actions. I am aware, however, that the Business Leaders Health and Safety Forum has estimated the total burden of workplace harm at $4.9 billion in 2024. Given the difficulties in estimating costs and drivers of harm, my officials have not modelled the impact of health and safety reforms on this cost, but it has been clear from my roadshows and consultation that a lot of effort is going into ineffective paper-based compliance, which doesn't reduce harm. My reforms focus on real actions to reduce harm.
Supplementary. How does she justify weakening health and safety protections for workers in small businesses when ACC data suggests that workers in small businesses are 57% more likely to suffer an injury than their counterparts in large businesses?
Mr. Speaker, I'm not weakening health and safety. I'm refocusing health and safety on critical risks. One of the clear parts of my consultation came back saying that small businesses are spending a lot of time on paper-based compliance. They're not sure if it's actually having any effect on reducing harm. But what we do know is we want people to focus on those critical risks that are causing death, serious injury and illness in workplaces, and that's what this government is committed to doing.
Supplementary. Does she accept evidence from WorkSafe that musculoskeletal harm, such as back injuries, are the #1 cause of workplace harm in New Zealand? And if so, will she include musculoskeletal harm in her definition of critical risk?
Mr. Speaker, the member will simply have to wait for the legislative drafting of the bill to come back with the definitions of critical risk.
Supplementary. Does she accept that the second biggest cause of workplace harm in Aotearoa is mental harm, associated with around 40 work-related suicides each year? And if so, will she include mental harm in her definition of critical risk?
Mr. Speaker, like I said, the member will simply have to wait for the legislation to come back and he can have a say at select committee on the specific definitions. But what I will say is we are seeing far too much compliance cost. We want people to be focused on those critical risks of serious injury and death at work. Businesses have far too much red tape and regulation, and they need our help as a government to clarify the law on where their focus should be.
Supplementary. Since she and the Prime Minister have committed to, quote, all Kiwis returning home safe after every working day, will she resign as Minister if her reforms result in increased workplace deaths or injuries?
Unfortunately for the member, I'm not going anywhere.